guess for my family, there's no better profession than to be a physician. So it's pretty much ingrained. And my brother is a physician, so it's just what we do. Soon after I became medical director for the Vermont State Hospital, we had a person die from complications of smoking. In this case, it was chronic bronchitis and frequent pneumonias. And we had 2 other people with newly developed cancers that are commonly associated with smoking. They had all been lifetime smokers. And on this unit where people had longer lengths of stay, we saw more complications and disability from smoking than you did from schizophrenia, bipolar disorder, depression, or any of the other reasons that were primary reasons, if you will, in some ways, for them to be in the hospital. The most powerful tool that we have is first starting to have the conversation. So I think not have this be a background issue, that it has to be the most active thing, whether it's in my conversation with fellow professionals or it's directly with a patient directly. It's addressing it, making it a priority is probably the most powerful tool. Additional tools, I think sometimes people don't know that they can call 802-QUITS and get resources such as nicotine patch, nicotine gum, anything that will help them get past the nicotine cravings, which are something to be reckoned with. It's a very seriously addictive substance. The issue of physicians' recommendations to patients playing a really important role, that cannot be overstated. People come to see their physicians to know what to do next, what's going on with them. They look for those opinions and they take them seriously. And research has shown this, certainly practice has shown this. When physicians do this, when they identify a problem and make it a priority, and same goes for not paying attention to something. So I think when sometimes we have unhealthy behaviors and the physician doesn't comment on it, you also do get this sort of permission. It's like, I went to see my doctor and they didn't say this was a problem, so this is fine. So I think that responsibility both to help give the right recommendations, to set the right priorities for their health and give them that advice. It may take them a while to come around, but the physician's responsibility and power to help make that change in somebody's life is not to be underestimated. The focus on the conversation and making it a priority for people, or helping them see what an important aspect to their health quitting smoking is, that conversation is probably the most key. Because once the person comes around to wanting to do this, all of the rest of the pieces can fit in. And yes, they need to know that, but the first task is to help them understand what the problems are, tie it to how it's impacting them today and what it might do to them in the future. And that's the really key first step. This is one area where our attitudes do really will make a difference. We have to look at smoking as a major health concern, and even partially condoning it affects people's lives, and not just affects people's lives, it takes people's lives. So the time for action is really today. I see a lot of change in conversation, much more so than we were even having 5 years ago or 10 years ago. And we have come a long way, but really we do have miles to go before we sleep on this topic. There's a lot of work to be done, a lot of attitudes to be changed. But the good news is it has pretty serious impact on people's health, so it's work worth doing.